Brain-computer interfaces by Gadieja Fortune, fourth-year physiotherapy student from the University of the Western Cape. Defining the technology. Brain-computer interface, also sometimes referred to as neural control interface, mind-machine interface, direct neural interface, or brain-machine interface, which literally means the collaboration or alliance of a brain interacting with a device to enable signals from the brain to produce a motor response. What this basically means is that with this technology, a person can control an external device by just thinking of the activity. Describing the clinical application. According to science reports, this technology is non-invasive, simple to operate, and at a low cost. It has been said that this technology has been attempted for patient rehabilitation, patient assistance, and many other fields. This sounds exciting, but unfortunately the BCI systems are still in laboratory research stage, which are aiming to correct any flaws or working on the reliability of the device, etc., before putting it into field practice. However, in the NIH public access stated that in the USA, California, practice interventions for mobility such as robotic gait assistive devices, which are quote, electromechanical assisted devices providing patients with either full or partial guidance of the lower limbs during the phases of the gait cycle. These assist with hip and knee flexion and weight bearing during swing phase, functional electrical nerve stimulation, trigger contraction and relaxation of the select muscle groups. On an online database, the University of Adelaide gave an example of how a BSI works. They said, imagine thinking about grasping, for example, an apple. The BSI takes the electrical signals and transports them to a computer. These signals are then interpreted and supplies a sensory feedback via a robotic manipulator. They then said, quote, BSIs have been proposed as an alternate therapy for stroke patients. They have shown some level of promise, but to date haven't been particularly effective. They have, however, tested a more modified design on a patient and results have shown the device to work. Describing the implications for physiotherapists. As stated by HHS Public Access, several studies investigated BCI as an add-on to traditional physiotherapy, but the effectiveness of the combined treatment was said to be difficult to discriminate between the outcomes of the BCI and conventional therapy outcomes. Although the literature is not there and research is still being done based on the HHS Public Access article, it's highly likely that physiotherapy will still commence with the conventional therapies, but BCI will still play a big role in future rehabilitation, especially in fine motor activities and mainly upper extremity-based treatment sessions. Discussing the ethical concerns. Central European Journal of Medicine said, quote, particular ethical problems may arise producing conflicts such as treatment and research interests, inconsistent safety and effectiveness, commercial applications, and common uses may cause problems like addiction to BCIs. This article and special interest article further states that getting consent from patients with certain impairments such as visual and neurodegenerative diseases, to name a few, may experience lack of response, which will then require informed consent and may be difficult to acquire. Other issues include patients' concerns for privacy and mind reading, and ethical dilemmas may also arise from sensitive patients introduced to complex technology. Ethical issues with brain-computer interfaces then further stated that multidisciplinary teams need to be cautious to not assume BCI indicates a fixed type of brain activity, as the patient may not always be in the type of mind frame to make decisions based on life and death. Recommendations to prepare physiotherapists for the future. I believe that the information on the new types of technology needs to be implemented within the university curriculum, whereas it will be things that we may see one day, and then how do we tackle something we don't understand. This way, the new students will be made fully aware of the technologies and may even find ways to harmonize the different treatments. It should be given its own module, and every year the teaching should be progressed, like any normal modules we have now. For the already qualified physios, we should be given classes or go to talks where the types of technologies are being discussed, and it should be added to our yearly points. We as physios need to take the initiative and learn as much as we can about these new advances, as we are currently in a very fast developing world, and if we do not do this, we can get left behind. Thanks for watching!